Hi, my name is David Villar. I teach pharmacology in a veterinary school in the country of Colombia. And this talk is going to be the first of a series that will try to cover the basis of the most common problems in dogs and cats, which can be very frustrating but also very rewarding. And I like to start by saying that diagnosing and treating the cause of diarrhea is not an exact science by any stretch of imagination, because many times we don't really know what we're treating for, and the role of many things that can cause diarrhea is not always clear, as we will see for infectious organisms. So on this first presentation, we're going to walk through the steps that could be taken in trying to make a diagnosis, which in reality can also be applied to any other clinical problems, regardless of what those may be. So the first thing in a problem-oriented approach is going to be gathering information from the history provided by the owner, and obviously your own initial physical exam. Then ideally you want to identify and list all the problems and establish rule-outs for those problems. And to help you organize your thoughts and making sure you don't forget any category of disease, you can use schemes like the one shown here with the acronym of damn it, the same as the idiom that we use when we're angry or annoyed. And then from there, you want to design a diagnostic plan based on the likely differential diagnosis. And this should be prioritized based on the clinical severity of each problem that the patient has, as well as obviously the client consent and whatever financial constraints he may have. So when you have done your preliminary results, you either establish a diagnosis or you simply redefine your differentials and then follow them up accordingly until you are confident of what's really going on the animal. Now, I'm not going to define diarrhea for you. I think we can all agree that is basically the passage of feces with an excess of water that usually results in high volumes of unsightly stool, and usually they come along with a greater frequency of defecations. Now, what's really helpful to begin with is being able to classify the diarrhea in some way. If we talk about functional categorization, this is something that is not routinely done, but as we will see for the other ones, it may be very helpful determining the cause of diarrhea and obviously the treatment. The diarrhea can arise from an osmotic effect by things that retain water in the intestines, or it could be from an alteration on the permeability of the intestinal mucosa when there is damage or some type of inflammation, or it could be a hypersecretory or because of some situation that is causing increased motility. I always like to show this picture to illustrate something that you may not be aware of. If we were to talk about say a 20-kilogram dog, there is going to be between 8 to 10 liters of fluid that goes in and out of the intestines every day, but usually by the end the fluxes are going to be almost equal and there is no net loss or gain of water, and usually very little water is going to come out with normal feces, and that's obviously all going to change when we have diarrhea. If the diarrhea is hypersecretory, the volume going in is going to be so great that it cannot all be absorbed farther down the intestine, and in this situation the loss of water will definitely cause a potential lethal dehydration. As opposed to this type of diarrhea, when we talk about osmotic diarrhea, in this case there is no change in the water going in the intestines, but what's affected is the absorption, whatever osmotic substances are holding up that water. And in this situation, that diarrhea is usually not as severe in terms of causing dehydration. What we're most used to is talking how long that diarrhea has been going on. If it is more than 3 weeks, we usually say it's chronic, and that's important because in most acute cases of diarrhea, they tend to be self-limiting, and patients are often going to get better despite of what we do and not because of what we're doing. And a good example would be a dietary indiscretion. And there is also another classification based on the location in the intestines, whether it's large or small bowels. And you've probably seen this chart here before. Most patients will tend to fall under one category or the other, and this can really narrow the list of things that will cause diarrhea. With small bowel diarrhea, there is usually a much greater loss of fluids with the stool. These are usually expelled a few times a day, 2, 4 at the most, and usually affects the condition of the animal to a greater extent than with large bowel diarrhea. And in chronic cases, if it is from small bowel, that animal is definitely going to lose weight because it cannot retain water, nutrients. And by contrast, if we talk about large bowel diarrhea, this is characterized by more frequent small amounts of stool. There is usually increased urgency, tenesmus, which is that straining that you might see when the animal is defecating, and we can even see mucus or even frank hemorrhage in the stool sample. So once we have classified the diarrhea, we usually put it together with all the other information that we have gathered from the owner and the physical exam, and that usually includes questions like the progression of the diarrhea, the appearance of the diarrhea, and here it's always helpful to use some type of fecal score chart like the one you see here, at least to determine how severe that diarrhea might be. Obviously, any changes in diet, environment, whether the animal is being in a kennel or recently been in a shelter, or traveling, these are always important clues as to what might be going on in the animal. It's not the same an adult dog that is being in a fenced yard as a puppy, for example, that is visiting dog parks or puppy classes. Obviously, the medical history is important. If there has been any previous illnesses, the deworming and vaccination history can rule out intestinal parasites and infections like feline polycythemia or canine parvovirus. If there are other pets in the household, you probably want to put contagious agents at the top of the list. And last but not least, if there are any other signs that could indicate an extra intestinal origin to the diarrhea, that's obviously going to be important. If we list the minimum database for a patient with diarrhea, it should probably include a CBC, a serum chemistry panel, and urinalysis, and this will definitely help you rule out extra intestinal causes of diarrhea. And it's obviously going to be important to assess the metabolic condition of the animal, whether it needs fluids, and whether the diarrhea is complicated, and he may have septicemia, and that's why the CBC it becomes crucial to get that information. As regards fecal testing is definitely mandatory here, and I want to emphasize the importance of collecting fresh stool samples. If you collect stool from a litter box and it's desiccated, or you collect it from a carpet and it's been there for several days, it's probably not going to give you any good information. And in those situations, you might just want to do a rectal flush with some saline and do the whatever testing you want to do out of the material that you might attain. Fecal flotation by centrifugation is going to tell us a lot more about the presence or the absence of roundworms, hookworms, as well as Coccidia and cyst of Giardia. The Giardia ELISA is a lot more sensitive than doing direct smears, but I'll have to say that direct smears can definitely should be in place, because if you find Giardia or Trichomonas, that's definitely not going to be a false positive. And sometimes we can find a lot of neutrophils to suggest like a salmonella or a clostridium infection. In cat, they usually suggest doing a fecal leukemia virus, feline immunosuppressive virus, as well as thyroid testing. If the animal is hyperthyroid, the chances are that the diarrhea is going to be secondary to the thyroid problem. Now, there are other tests that are not included, obviously, in this minimal database, and I'm not going to go into the detail, but if you don't come up with a diagnosis, you might want to do a radiograph, ultrasound, endoscopy, and those techniques will probably tell you things that you might not be able to pick up with the other techniques that I just alluded at. So because parasites are a very common cause of diarrhea, I think it's convenient to discuss them separate. And I'm just showing here the Companion Animal Parasite Council, or also known as CAPC. The website provides excellent guidelines for the diagnosis, treatment, prevention, control of both internal and external parasites. They usually recommend doing fecal screening for parasites 2 to 4 times a year if these are puppies or kittens, and at least 1 to 2 times for the adults. They also suggest doing year-round prevention with antihelminthics to prevent new infections from taking place, and they suggest monthly preventatives. Now, in my opinion, and in light of the resistance that at least is developing in large animal practice, I think this should probably be reconsidered if that fecal exam is going to be negative. The one thing to mention is that the fecal flotation by centrifugation is at least 2 to 3 times more sensitive than just doing a simple flotation. In other words, if there will be probably more eggs that will be recovered this way, and therefore the chances of false negatives are decreased. Just to show you the relevance of parasites, I want to show this prevalence map from CAPC, and this is definitely an excellent visual prop that you can show owners to illustrate the risk of infection in different states of the US. That the owners don't see the parasites coming out of their pets' poop does not really mean they're not infected, and in fact they, at least on this website, they say that 9 out of 10 puppies under 3 months of age are likely to be infested. So you just have to tell the owner that because the parasites are out of sight, they shouldn't really be out of their mind, particularly considering that many of these parasites are zoonotic for humans. Now, most of the times these parasites, as I say, will not cause disease, and you could say they're a hidden problem. And but that's not always the case, particularly in puppies and kittens that are more vulnerable to hookworms and roundworms than the adults. And here you can see some of the clues that should tip you off that the puppy is infected. Interestingly, they miss diarrhea on these diagrams, so we should probably put that here in the picture. And roundworms are like big thieves. They steal nutrients from the animal needs. And if you see this distended, bloated belly, you always have to think about roundworms. And sometimes you'll even see them being expelled with the vomit. And that sometimes happens because there are so many in the intestine that they just don't fit, and they have to go and reside in the stomach. Now, if we talk about the other group of important worms, the hookworms are another elements that we have to consider, and these are definitely probably more dangerous than the previous ones, because even though they're smaller in size, they're usually found in really large numbers, and they're like little vampires that suck blood from the intestines. And I'll have to say that I've done necropsies in adult dogs that die with severe anemia, and I found so many of these guys in the large bowels that is something that at least I keep in mind when I have an animal with anemia and at least large bowel diarrhea. So now let's further refine the fecal tests that are commercially available. Can definitely help us get closer to a diagnosis. There is always the classical fecal cultures that can isolate a specific bacteria. The downside is that normal animals can be carriers of the same bacteria, so interpreting the results is not always going to be straightforward. If you get a pure heavy growth, it's more likely to be significant. The turnaround time is between 3 and 12 days, so in the meantime you may have to treat empirically. And in the next slide we will discuss the real-time PCR, which is now available with laboratories like IDEX, and they offer really a lot of advantages that were not available until now. There is also the fecal in-house ELISAs, and as you can see here, we can detect parvovirus, giardia, cryptosporidium, and obviously you can get an immediate answer with these quick assays. And with regards to the real-time PCR by IDEX, I'll have to say that at least they don't require any special media, so as opposed to fecal cultures, the turnaround time is a lot quicker, 1 to 3 days, and the panels also include other agents, at least viral and protozoas, that you cannot really detect with the other ones. And usually the same drawback as cultures applies here, in the way that normal animals may also harbor these organisms, and I will show you a study in just a moment to illustrate these. The good thing about these panels is that you can see, you can detect a lot of organisms in just one test, and obviously that becomes cost effective. If we look at this consensus paper that was put together by the by the American College of Veterinary Internal Medicine, it basically tells us that there are a lot of asymptomatic carriage, which means that the infection will not always cause disease. So if you see the prevalence here, it's pretty high in normal animals. Obviously that varies from one study to another. But the bottom line is that the cause of diarrhea could be nothing related to any of the organisms that we're detecting, and yet that can definitely lead us to misdiagnose what's truly going on. At least in acute cases, most of these infections are going to be self-limiting in nature. So just keep that in mind. So here is a recent study that again shows that the presence of potential pathogens is not enough to establish a diagnosis. In this case, they look at 169 puppies of less than a year old with and without acute diarrhea of less than 1 day of duration, and they screen for all the pathogens that you see on the list. And I'll have to say that except for Salmonella, the prevalence of most of those pathogens was similar or very close in both healthy puppies and those with diarrhea. So if we look at this other study, in here they look at 100 cats with diarrhea. They did the real-time PCR for 8 enteropathogenic species. Coronavirus was present in 60% of the samples. I don't think this is a pathogenic organism as far as I am aware, unless maybe if you have a systemic feline infectious peritonitis. 56% of the samples were positive for the gene that produces the toxin of Clostridium perfringens, and about 20% had either parvovirus, giardia, trichomonas, or cryptosporidium. So with these many pathogens involved, you may wonder, well, how do I decide what's truly important? Well, if you have Salmonella or Toxoplasma, that's more likely to be the real theme, because neither one of these two organisms should be present to begin with. And if we look at this other graph, most of the cats had either 2 or 3 or even 4 different pathogens. So looking at this, you start wondering which one may be the real or the evil one, or should I just treat for both of them at the same time? With regards to Trichomonas, it's kind of a party organism. It doesn't like to be on its own, so to speak. So, and it could definitely cause diarrhea. So it's one of those organisms that sometimes you treat for everything else except for this one, and until you get this one on board, you're not really going to take care of that diarrhea. So really, from a practical standpoint, it's really difficult, and you don't always know what to treat for. And as we will see when we talk about treatments, many times the diagnosis is going to be based on the response to the different treatments. So if we have said that identifying a pathogenic organism is not enough, I think I got that point across. But there are additional tests that can increase the chances of getting closer to a real diagnosis. So I want to show you this example in which they compare different assays to see whether Clostridium perfringens may be associated with the diarrhea in dogs. And as you can see, the organism was again cultured in a lot of dogs, up to 70% of them, whether they had diarrhea or not. But only 14% of those without diarrhea were positive for the presence of the enterotoxin, as compared to 34%. And when we combine the presence of the gene that codes for that toxin by PCR, then there were only 4% of the dogs without diarrhea that were positive, as opposed to 28% that had diarrhea. Now again, obviously, you cannot tell whether the Clostridium perfringens is the primary cause of the diarrhea. This is just an association which doesn't imply a cause and effect relationship, and that's the reason why I said earlier that diagnosing diarrhea is not an exact science, like it could be for other type of diseases. And to show you a clear example of what I mean by primary and secondary cause of diarrhea, let's take a look at this other study. Here they had 5 dogs with chronic recurring diarrhea. They were all positive for Clostridium difficile infection, and in all of the 5 cases they also identified or detected the toxins of the organism, and they did not respond to the treatment with metronidazole. Well, in this case, all the animals responded when the diet was changed, and that basically indicates that there is a food allergy or some kind of intolerance of some constituent in that food, and that was definitely the main cause or the primary cause of the diarrhea. So the conclusion in this case was that the disruption of that microflora caused by the offending diet had allowed the proliferation of the Clostridium difficile, and that was a secondary event. And until that you change the diet and get that offending constituent out of the diet, that inflammation in the intestine is not going to resolve, and the Clostridium is probably going just to take advantage of that. Now, to end the presentation, we're going to see how we should approach a diagnosis of chronic diarrhea, and you will see why classifying the diarrhea into acute or chronic becomes important. So if I were to ask you a poll question, what would you think are the main causes of chronic diarrhea that you probably see in practice? Well, the infections definitely are going to take a second seat, or second row seat, so to speak. And the answer here is going to be dietary, that is causing some kind of inflammatory bowel disease. So on this study, in the Journal of Veterinary Internal Medicine, the objective was precisely to evaluate the underlying causes of diarrhea of more than 3 weeks of duration in 136 dogs. In the introduction, they mentioned that non-infectious conditions seem to be the main cause in most other studies, and the term non-infectious inflammatory bowel disease is used to refer to those type of diarrhea that respond to a change in diet, and if that doesn't work, they could also be an antibiotic responsive diarrhea, and when there is no response to neither one of those two, then they may be responsive to an anti-inflammatory or immunosuppressive drug, and they call this last one an idiopathic inflammatory bowel disease. So regardless of which is the origin for these three types of enteropathies, if you were to do a biopsy, basically the histological evaluation will not be able to distinguish between any of the three. And that's the only way of making a diagnosis is going to be by response to sequential treatment trials. So in this case, they started with 209 dogs, but in the end, only 136 met the criteria of having a minimum workup. And in those 136, they could make a final diagnosis with good confidence. So basically, they took a stepwise approach to characterize the non-infectious inflammatory enteropathy. And that was, as I say, based on the response to treatment. They started with an elimination diet for at least 4 to 8 weeks. And if there was no improvement, they introduced antibiotics for at least 10 days. They used either metronidazole or tylosin. And if that didn't work, they were put on prednisone or cyclosporine to see if it was a steroid responsive enteropathy. So as you can see, this other slide, 90% of the animals had a primary enteropathy. In other words, the origin was within the intestines, and 10% had an extra intestinal cause to the diarrhea. Now, the most common primaries were non-infectious inflammatory diarrhea with 71%, and of those 71%, 66 were diet responsive. Now, whether the nature is allergic or simple food intolerance, where there is no immune system involved, obviously that could not be determined with the assays they did. And they point that some animals had skin disease and itching, and that would obviously point towards an allergy. Now, what I found interesting is that only 13% were infectious, and these were mostly caused by Giardia. If you look at other studies, you'll probably see that Giardia is a much bigger player in chronic diarrheas. They didn't report any bacterial causes, even though they looked for most of them, and they attributed these basically to the fact that bacteria is usually a self-limiting diarrhea. In other words, if you have an acute diarrhea, you definitely want to include the bacteria, but not so much if you have a chronic diarrhea. Also, only 4 dogs were less than 1 year of age, which are definitely the ages that you would expect to find diarrhea caused by roundworms and hookworms. So from this study, we cannot really exclude big worms as an important cause of diarrhea. And it may also be that the study was done in Berlin, in Germany, and it could be that the owners are really conscientious doing preventive treatments with anthelmintics. And it could also be that there are not many stray dogs in the city to keep the population of roundworms around. So who knows why they didn't detect really any big worms on this study. As you can see, 13% were diagnosed as antibiotic responsive diarrhea, and 23% had idiopathic inflammatory disease. Lymphoma accounted for 4% and was the most frequent neoplastic disease. And of the secondary enteropathies, exocrine pancreatic deficiency was the most frequent. There were other endocrine disorders like thyroid and adrenal problems. These accounted for a few cases. And finally, you have to include liver, kidney, and heart diseases that could also be associated with diarrhea. So as you can see, for chronic diarrhea, the diagnosis is going to require basically a stepwise therapeutic trial with an elimination diet, and many will also need to go through an antibiotic or an anti-inflammatory drug trial to see if they fall into any of those other two categories. So in summary, searching for the causes of diarrhea should kind of follow a problem-oriented approach. Classifying the type of diarrhea and doing a minimum workup should be performed. before we can come up with a list of differentials. Acute diarrheas tend to be self-limiting, but they can be life-threatening if they are not treated properly. With chronic diarrheas, remember that the diagnosis is most of the times made based on the response to an elimination diet first. And if that doesn't work, which is the most common cause, then you may have to go into antibiotics or trial with immunosuppressive drugs. Just keep in mind that with both acute and chronic diarrhea, the treatment response is going to be essential to establish a definitive diagnosis, because as you just saw, there are multiple things that could be going on at the same time, and that's why it's not an exact science. And finally, we have not really talked about how all the clinical and ClinPath results become important, at least to establish a prognosis. We'll probably address that in more detail on the following video. So this is the final slide. I don't know if you may be more confused now than you were before. This is a topic that can be addressed in many different ways, and it makes it quite daunting explaining in just a short video. So I hope at least I have provided some tidbits that will help you reaching a diagnosis in whatever cases you're confronted with. So again, thanks for watching this presentation, and bye-bye for now.